So, what is mental health? Mental health is a word that is being used around quite frequently, quite easily. But do we know really what mental health means? So, just like there is the body health, which means the health of the body, the physical health, there is a term mental health. This mental health means the health of the mind. And what is this mind? There is no specific part in the body which is the mind, but it is basically inside the brain which thinks, feels, and thus behaves. And thus we think positively, we feel positive, so we behave positively. And sometimes there is an issue with this process. There is an issue with this cycle, and so we start thinking negatively, we start feeling negatively, and thus our behavior turns out negative too, where we get affected at work or we get affected at relationships with our friends, with our family, or anyone else. Now, nowadays, Gen Z has been using this word sadness and depression quite commonly. Is it really the same? Is depression being equated to a just sad day at work? Is it so commonly used that people misinterpret it, misunderstand it, and thus are not getting treated adequately for it? Because there are a lot of people saying that it's okay, you're just having a simple depression and it will get better by itself. No, it's not going to happen like that, because mental health has issues with the chemicals in the brain. Now, these chemicals are the neurotransmitters of the brain, and that is how we explain to our people that there is a chemical imbalance in the brain leading to all these problems. How do we equate this? Let's understand this in terms of a car. And when there is a problem or there is a reduction in the petrol in the car stops functioning, stops working, it can't go further on. The same way, the petrol of our brain is the chemicals, the neurotransmitter, namely serotonin and dopamine. We all have heard these words so commonly on social media, but do we really understand it? So depression is much more than just sadness. Depression is sadness also including reduction in your physical activities. You're unable to go for your work. You don't feel interested in things. You're unable to focus. You feel disconnected with people around you, and most importantly, you are feeling suicidal at any point. So these all things also encompass under depression, and depression is not going to get better by itself. So is not any other condition such as anxiety or schizophrenia or bipolar disorder. These conditions require treatment in the form of medications or sometimes therapy. So always visit a specialist, inquire about these symptoms, and find the right solution for these problems.